why. The real value in testing is to identify at an early stage of the infection who has been infected, who are the contacts that have been associated with those that are infected, and isolate them. We have missed the window of opportunity to some extent to use testing in that capacity now, in that by now there's been wide exposure across large segments of our population. Now, there's still a role for testing. That is, we still need to try to figure out who has the disease and who doesn't. The problem is that identifying those early infected patients who have risk for spreading the disease and identifying their contacts to isolate those and separate them from the healthy groups in the population, well, that ship has sailed. We've kind of missed that opportunity to some extent. Testing is still important, and we shouldn't be overly alarmed by the numbers ramping up as we start testing, just because if you're not testing anybody, the numbers are going to be low. When you start testing people, particularly when you start testing late in the game, we're capturing infections that have already been in the population. And it's not that the rate of infection necessarily is expanding as fast as the numbers look like from positive tests. And so I think testing is important. I don't have any specific access to information about when that testing will become available. And I think it's it clearly, the lack of early testing places us on a trajectory that is very concerning from a public health perspective. And it makes it much more likely that the experience that we have in this country is going to mimic something like is being seen in Italy, as opposed to something that has been seen in South Korea and Singapore, where very aggressive early testing, isolation of cases and contacts has resulted in leveling off of the rate of rise of infections in those countries. And so I have significant concern that even the more aggressive social distancing that we're doing here in California, which has been mandated now, under the Safer at Home regulations, may be slow to affect the rate at which severe infections occurs. And I'm very concerned about our hospital systems and our hospital beds and ventilators being numbers being overwhelmed by the number of patients that become ill because we haven't effectively developed an early identification strategy.